Hello again, everyone. My name's Marty Guthmiller, CEO, Orange City Area Health System, coming to you with the 26th edition of our COVID-19 community briefing. Today's briefing will be a little bit different in the fact that I'm not going to provide a local scoreboard, primarily because I wanted to get the briefing out today and I haven't yet received today's results. But I do know that they're not expected to be anything of great interest or consequence. We're expecting no significant changes, and we still have no hospitalizations here in Orange City. So we're going to skip that part of the scoreboard for today. I'm going to jump right up to the hospitalizations by county. I do think that information is important, particularly relative to the intensity of the illness or the acuity of the illness that is out there. Hospitalizations by county, first of all, there are 286 hospitalizations in the state of Iowa, and that number's down from 292 and down from previous times we've talked as well into the 300s. That's an important stat, but it's also more important probably locally what's going on and regionally. Sioux County does have one hospitalization that was reported. O'Brien and Lyon County remain at 0. Plymouth County has reduced 1 from the last time we talked to 3 currently. Woodbury County down from 44 to now 40. Buena Vista County up 2 from 14 to 16 as of today. Polk County is currently 88, which is a lower number than they've had, but actually 3 patients higher than the last time we talked a day or two ago. So Polk County at 88, total at 286 for the state, but regionally in the 4-county area, we have 4 inpatient hospitalizations. Sioux County, the number of tests conducted in Sioux County are 1,564. That represents 1 out of every 22 residents of the county. We have 293 positive results out of that 1,564, and that's an 18.7% rate. And again, we've been talking about that rate, and we expect it to go down as the number of tests go up, and that in fact is happening. It's down from 19.2% the last time we talked, so it's currently at 18.7. By the way, as a reminder, our percent positive here in Orange City yesterday, or 2 days ago when we talked, was 7.4%, and we do expect that number to continue to go down as well due to the number of elective surgeries that are provided. Stepping up again a level to Region 3, we have 88 hospitalized in Region 3, which is 20 counties in Northwest Iowa. Yesterday, when we visited, that number was 87. We had 3 patients admitted in the last 24 hours in those 20 counties, and we have 40 patients in the ICU in those 20 counties. Yesterday, or 2 days ago when we talked, that number was 43. So pretty good numbers, generally speaking. Iowa, as a state, now has 20,700 positives. That's an 11.9% rate. Again, as we've been talking, we do expect that number to go down. It in fact is going down. On Tuesday when we talked, that number was 12.2%. So that rate continues to decline as expected. There have been 578 deaths in Iowa, and I continue to mention that because it is important that we pay attention to this. It is still a concern, of course. The number that's changed there is gone from 87% 61 and over to 88% 61 and over. So it remains an older person kind of higher acuity level and higher consequences. And so in Iowa, 578 deaths and 88% above 61 or 61 and over. I want to talk a little bit now just about a couple things that are going on. You know, we get some questions periodically in response to this briefing, this video, and we really try not to respond too much because things can get misinterpreted. And so we prefer to communicate some of those issues or questions in this form. So I'll go through a couple of those. First of all, we have a new hospital visitor policy that will go into place Monday, June 8th. And there are many details, of course, to this, but the general point is that we'll have one designated visitor per day on the floor. So a patient in the morning can designate a visitor, and that person can come and go throughout the day. One person for an adult, and we will allow 2 people for pediatric patients. Again, those would be designated people, and 2 per day. OB is largely the same as we've had it all along, except for one change. And the policy all along has been you can have one support person for an OB patient, but that person has to stay the entire time. We're going to be moving to one person is still designated, but that person can come and go throughout the day, or go home and sleep, for example, and come back. But it's still one person for the entire stay, but that person can come and go. Same day surgery, again, one person, one support person, one visitor can accompany a patient for same day surgeries. And again, like the floor, pediatric patients as defined 17 and under can have 2 support people, mom and dad, as an example, if that is preferred. So again, those things will take place on Monday, and including an hours of visitation. So we'll have 8 a.m. to 8 p.m. And so that's done because we have to have people that'll look at lists and do screenings and that kind of thing. So we're going to limit visitation to 8 to 8, but open it up in the way that I've described. We've had a question on knee replacements and when they will begin. For those of you on the list, and there's a pretty good list of knee replacement patients, good news. We are beginning knee replacements again. In fact, if you're on the list, you can expect to be contacted very soon regarding that. Dr. Jacobson will be reinstating knee replacements here at the hospital. One of the reasons that we backed off on that, of course, was inpatient surgeries were not allowed, but also the primary thing that with knee replacements, there's another person or 2 in the OR that would consume more PPE, and then also we needed to keep room on the floor in the event of a surge or that COVID-19 patients might need those rooms. We're fine with PPE at this point, personal protective equipment. We don't anticipate any shortages with that, and we certainly don't anticipate a surge anymore. And so we do have the room capacity in the hospital. Knee replacement people will probably accelerate it in their rehab a little bit, might get to go home a little bit sooner. But the main thing is that those replacements will start very soon. And we're looking forward to that and get everybody back in the groove again. I think I mentioned this earlier, but I want to repeat this, that the medical clinic has returned to its original location as of last Monday, June 1st. And it's in the original location, but we moved some things around a little bit. And so when you do get contacted or you make an appointment, you'll be instructed as where to go, what part of the waiting room. There is an acute area and there's a well clinic area. They're not necessarily going to be marked, but where you sit will be indicated by the provider that you're going to be seeing. And so we're cognizant of all the issues that we have, and you'll be directed to the appropriate place. So again, if you're coming in for a family practice clinic visit, come in the front of the hospital like you always did, the north entrance, and you'll be directed to the proper location. Another and final issue that we have that is a concern, of course, is opening up senior care again. And we are expecting tomorrow the state of Iowa, Governor Reynolds, to issue guidance relative to opening senior care facilities. We're anxious for that. We're anticipating that. We will implement those policies as we are able and as soon as we are comfortable with how those policies affect our location. So when you just have a blanket policy from the state, you have to look at that, apply that to your local physical location. Does it make sense? Can you do it? Can you execute all the things that they're suggesting? And sometimes it means yes, sometimes it means kind of, and we'll be selective on that. But we will open that up as fast as we possibly can. It's been a long time for our seniors in this environment and our healthcare workers out there, and we want to do that. So look for some announcements tomorrow. We will be looking at those as well, and hopefully we'll adopt what we can beginning very soon and in accordance with those guidelines. So that's it for today. I just want to remind you to stay vigilant, stay strong, and stay healthy. Have a great weekend, and we'll see you next week on additional community briefings. Thanks for joining us.